I need to say this before we leave this discussion.
Okay.
When Judy and I were up in the balcony, and every time we use that facility for a public event, or we're there enjoying a show like we did, we have to remark about those of you that made this possible for Monroe. The theater is a primo theater. For people that enjoy going to the theater, they're beautiful, cushiony seats. A 2.5-hour show, 3-hour show like that is not a problem when you have those cushiony seats. The acoustics are primo. So again, we appreciate for those of you and the people in the community that donated private dollars that made that happen.
Yeah, and that's one of the reasons I brought it up too, is because that building was somewhere around $13 million.
That's correct.
The state provided approximately half of that, and there was some money put away also for future endeavors. But this new building at $17 million, about half of it's going to be coming from the state. We're going to have to raise the other half from the community and with the help of the foundation. Is that right?
That's correct. And that work has already begun, as you know, in fundraising. The silent campaign has been underway. Sue Wetzel and the staff has been working on that. We have some very enthusiastic potential collaborators. I'm going to mention one of them, although we haven't asked this individual for a major gift yet. We have one individual that's starting to supply jobs to Southeast Michigan, of course, and that's Reed Medical Services. We've currently at the college been customized training ophthalmic assistants who are training in 10 weeks and get a job right away. And Dr. Reed talks about the future, the need for more of these individuals, and another specialist that would be an EMR, an electronic medical records person. So the future is bright there, and Dr. Reed has expressed an interest in maybe being in a portion of that facility on campus and hire students.
Yeah, and he and I have had some discussions about the potential of his business, and not just Reed Vision, but something else that
RMS,
he's got
right,
called Reed Medical Services,
Yep,
I think
that's
maybe,
correct.
That is going to grow and could potentially have a big part in this. Dr. Reed certainly is a visionary, no pun intended.
He is absolutely a visionary.
But I think that is one of the partnerships between business, education, and government where we could have another success over the long run. I'm looking forward to working together.
Well, in addition, as you know, he's a fine surgeon, eye surgeon.
Did mine, by the way.
And, well, very good. And he has gained that reputation as a professional eye surgeon. But he's also an entrepreneur, and we've known him long enough that he is going to establish something really good for Southeast Michigan. And I'm glad that the community college can be of service.
Well, we'll keep that.
Right.
Keep that on the radar screen. You know, one of the core missions that the community college has is to help keep education affordable. And in the tough economic times that we're going through right now, where people are more apt to have an opportunity to go back to school, how does the community college and its board of trustees help people to afford to go back to school?
Well, it's a challenge, as you just mentioned, because the costs are getting greater, the cost of operating. The trustees of Monroe County Community College for years have been very adamant about keeping that the lowest tuition. So this year what the trustees have voted to do, instead of raising the tuition, keeping the tuition's $67, and that's what it's been for the past couple of years, instead of raising the tuition, there are some programs that the students will be charged by contact hours, and the reason for that is that faculty pay is based on contact hours. In other words, there would be some programs, and I'm going to mention culinary arts, where the faculty spends a lot of time with the students. Those are all contact hours. Nursing, the healthcare programs in general, all of those. So there will be a contact hour charge in those programs. Now, what about a student that comes to us and says, I don't know if I can afford this. And by the way, our tuition is still a real good value in spite of that. Our financial aid department says more than 60% of our students qualify for financial aid. And in addition to that, for the first time in our history, the federal government has raised the Pell Grant. Now, the Pell Grant is something that students don't have to pay back, and when they qualify for that grant this year, they'll be able to get as much as $5,300 for a year of schooling. And of course, that's more than a full ride at Monroe County Community College. So there are a number of ways we can offset those higher charges.
Okay, great. Well, those things are obviously important, especially when I think people, when they talk about the state, don't realize that we fund the public universities, and there are 15 universities in Michigan. 3 of them are research universities, Michigan State, Wayne State, and the University of Michigan, and also provide scholarships for those that are going to private colleges in Michigan, but also the community colleges. Out of the overall amount of money that the Monroe County Community College gets, about what percentage comes from the state?
About 16%.
About 16%.
Right.
Can you tell? Because I think people need to know, where's the rest of the money
It used to
come
be
from?
20. When I came here 6 years ago, it was 20, and it started. But that's not surprising to me, because in my previous community college job, we went through the same thing when there was a double recession in that part of the country. And many of the strategies that I use every day in this job are patterned after what we did to respond to those other issues. Well, here's where the rest of the money comes from. Fortunately, the taxpayers of Monroe County years ago voted for a perpetual mill levy, and that supplies 52 to 56% of our annual $25 million. So we owe a lot to the taxpayers, and we're always telling the community how much we appreciate that. And many of the events at the Lazy Boy Center, as you know, are free for that reason. Then the other portion of the funding pie is the tuition, of course, and that's the amount that the students pay. So if the property taxes were staying what they used to be, staying about the level they used to be, and if the state appropriations dwindle, we can meet those challenges with some tuition adjustments. The thing that we're faced with right now, as you know better than anybody else, is for the first time in years, the property taxes are taking a dive, and that means we're going to have less money. So we have to look down the road and adjust for that right now, and that's the reason why we needed to adjust the method of charging tuition to be able to make up for that. We've promised the staff, we've had numerous budget discussions, that we're not going to lay off anybody. That's our goal. We don't want to lay off anybody. But there are some major cuts that we're making. Our administrators and our support staff voted to forego their raise for this next year. We're currently in discussion with a couple of our collective bargaining groups, including the faculty. We haven't been successful at getting that opened up again, but we're going to pursue that. The 3 vice presidents gave up $9,000 a year, which was a sacrifice, personal sacrifice, because that's what the college gave them to pay for their cars that they used for their work. So in the future, they'll purchase their own cars. But and the college president, I did the same, because they were doing the same. But we're doing that to demonstrate some leadership in these difficult times, because we want to avoid some of those less desirable things down the road.
No, appreciate that. And it is a very tough time, and a lot of people are making sacrifices all over. One of the fastest growing needs, I think, at least as I look from Lansing, is in the area of health care. And I know that the community college has done some things specifically with the nursing program, which was recently the best in the state. I think the highest percentage of those passing the exam first time. So what other kinds of health care things are happening out at the college?
Well, due credit to our faculty and staff in health care, regardless of how difficult things are, we expanded the health care programs anyway. The dean of that division, Don Wetmore, expanded another entry point for RNs, because there was more than 100 students each year that are waiting out there to get in the RN program. So now she's entering students in the fall, and she's entering another group in January. In addition, we added the LPN program, which is the second step on that career ladder. And then we added the CNA, the Certified Nursing Assistant. So a student can come to the college, they can start in the CNA program, which is 6 to 8 weeks long, and they can get that done for less than $1,000. They can get a job immediately in a care center or a hospital as a nurse's aide, in many cases with full benefits while they're doing that. Then they can come back on a part-time basis and come into some of these other health programs, or they can move right up the second step into the LPN. But in addition to that, Monroe County Community College added some other certificate programs in the health field, like pharmacy tech, phlebotomy, ophthalmic assistant that we just talked about, and a couple of others, medical billing. We know that these jobs are quick fixes, but in our history, we're probably going to see more adults. And when an adult comes to the college and wants to get a job, they might not be able to do a 2-year program with family obligations, but they could do one of these short-term certificates, get into a job and then pursue a longer degree.